Remind me, like, the homework that I gave you the last time and what you were going to be working on.
Yeah, well, I've been doing the sets of strengthening things, you know, like lying on the back, my leg up in the air and flexing up and down the hips, and then
The mobility. Yeah.
yeah.
And which ones are you finding most restrictive or most difficult to do?
The squat one.
And where do you feel it? Like, is it in the knees or?
Yeah, I don't get right down.
Mhm.
I'm getting further down. Like I've gotten further down than like in the start. It was pretty hopeless.
Okay.
Now I'm sort of getting down to what, like I'm probably beyond 90 degrees of my knees,
Uh-huh.
but not like they sort of lock up at the back, you know, and like it's almost like there's too much at the back. They get tight at the front. I can't bend any further.
Right. Okay. So it's tight in the back. And if you do module 2, the forward and back, is it easier to pull?
Um, Sort of varies. They stiffen up a bit with that one, you know. Sometimes I almost feel like I'm not getting much at all. But I do, you know, then I'll get there, and I think it's because I've been working on a bit. I've been getting sort of swelling and that, so it's sort of restricts a bit more. But then I'll get them all right. I had a funny thing with my right knee was when you know the twisting one, when you got your knee like up your foot on the ground, you twist it.
Mhm.
Pain interrupt your twist around.
Mhm.
You twist it left or right.
Yes.
Felt like I went too far one day.
Oh, okay.
So I went, oh, geez, you know. And that gave me a little bit of grief for a little while, but yeah, it wasn't major, but it was just like, so I'm sort of getting loose and slipping with it sometimes, and I think it's mainly, you know, after I've been working them a bit, that they sort of seem to get a little bit of swelling or something, so they restrict a bit.
When you mean you work on them, you mean you're working, or you're doing the pain pattern interrupts?
When I'm doing, like if I'm going out and doing exercise.
Okay. Okay. Um, I'm gonna go out on a limb and say you might have pushed yourself a little bit too much with the surfing and the biking and all that. Like, not the fact that you went surfing and biking, but like the distance. Like doing 30 kilometers. That's a ways on a bike. 60 kilometers. Okay. Well, but what I'm saying is, like, if you did 10, we'd be having a different conversation. It's not like what we're doing isn't working. It's more of like a recovery thing because we're pushing too much too early. That's what I'm thinking. So I'm thinking, like, I don't want to change anything, because if we change what's been working but it's because you've been exercising too much, then it's not what we've been doing, it's the exercise piece.
Yeah, no, I can see that.
It,
Yeah, that's why I sort of I've stretched out the spike balls a bit, because I figured, well, give myself time to get my program
yeah,
before there, you know.
yeah, and that's fine, and I, that makes sense. What I do want you to pay attention to is when you do the squat,
Yeah.
I want you to focus more on the tension from your waist to your shoulders rather than in the knees. Because there's sometimes, because we're so tensed up protecting the knees, that the legs can actually stretch further, but we're holding tension, kind of like the term waiting to exhale. It's like we've gone and we're just holding it. And I'm curious, when you're doing the squats, if you could see how you could, like, relax as you're going down, and that may be helpful. And the breathing, module 2 in the breathing room would be helpful with that. Oh,
and they're unreal. But they sit there with their feet flat on the ground, and you know their knees like bent like this, their bum virtually dragging the ground. They sit there, they just come straight out of it, just effortlessly, you know.
yeah.
I don't get jealous of anyone, but I look at them and go, "Geez, I wish I could do that."
Yeah, and you can. Like, I'm here to tell you that it's like it's possible. I'm more flexible now than I was in my 20s.
Yeah,
You know, I just turned 46 last month. So there's this, you're on the right track. It's we got to do it like it's got to be like this long, slow kind of improvement thing.
yeah, that's what I've been thinking lately. Like, I sort of guess at times I get a bit impatient, and I was thinking the other day, well, it's April and I started in January, and I was sort of thinking when I started, well, I've got to look at least 12 months,
Hmm.
and you know, it's been sort of free, and you know, but it's probably because I've actually come a ways that I'm sort of looking for more, you know, and I guess, and I'm getting more. It's sort of slowed down, but I can sort of see that things are advancing.
Hmm.
I guess the thing is, I'm going, well, are they going to keep advancing, you know? And I guess that's you know, from being where I'm at, and being sort of where my knees aren't bothering me at all, sort of thing. You sort of go, oh, will I get there? And I guess that's what sort of makes you wonder a bit, you know. Like
Yeah.
I just mean it's like, yeah, you get a bit of improvement, you sort of get a bit greedy or want a bit more, you know.
Understood. Yeah, I mean, I was the same way. It took me 5 years to kind of get finally quit like doing things that I was actually throwing myself back into pain. And I even do it from time to time now. But as as many ways as there are into pain, there is as many ways out.
Yeah, yeah. I've noticed, like, I know with the pain interrupts, like, I used to come home and my knees would be that sore and swollen and stiff, and I'd be dropping Voltarens to get the swelling down, and you know, like hobbling around. And now, you know, I mean, not sometimes the pain interrupts don't, like they always seem to improve them.
Hmm.
Sometimes you think, yeah, I'm gonna have to do another set of those in a couple of hours, you know, and then like other than proof, but I know that I've got to give them a bit of rest and then do another set of them, and then I'm usually pretty good, you know. Sometimes it lingers, you know, I'll get a niggly thing that lingers for a day or two, but each time you do it, you sort of feel it. You know, I'm starting to feel what they're doing. I mean, I've felt it for a while, but like I can sort of read it a bit more.
Hmm. Yeah.
So yeah, it's definitely working.
Yeah, and all it is, it's like, well, you're a builder, is that correct?
Electrician.
Electrician. So there's subtleties and nuance. How many years have you been doing it?
About
40, right. S-
40, 4, yeah.
yeah, so you see new electricians that come on the job that have only been working for like 3 months, let's say. An electrician's been working for 3 months. And how he would look at a job and do a job is going to be completely different than someone with 40 plus years of experience. And you're going to be like, oh, why are you doing all of that? Just do it this way and it'd be so much easier and so much faster. And that's what we're doing, is we're getting you up to speed with getting your knees out of pain. And there's subtleties and nuances that I can't point out. It only comes with experience. I can't point. Yeah.
I feel good with that. Yeah, like it's sort of enlightening. You know, you're picking up that this is helping, that doesn't help. You know, oh, this is funny. I need to do this. You know, I'm sort of getting a good read on what I need to do. You
Hmm.
know, and feeling it. It's funny because when you first start, you're sort of going, that same movement, there's a lot of movement now.
Right.
You know, like it's sort of like you said, pulling backwards and forwards at times. Yeah. And it's sort of like I'm pulling back and forwards to see where I'm getting the best movement, and it's all of a sudden I go, hang on, I've got to relax a bit more. I'm stiffening up myself.
Right.
You know what I mean? I'm
Yeah.
sort of picking up those little nuances where, like, okay, it's not that the knee's not got that movement. It's that I'm sort of tensing up a bit too much wanting to move, but you know, I've got to sort of take a deep breath and relax, and then sort of do it again. You know, so yeah, I'm feeling like I'm more into the micro than I was. Like,
Yeah.
but I understand it more.
Yeah.
I remember the first time you showed me a few things, and I was sort of going, oh, really? Like, you know, like, am I getting anything there? But now it's like, yeah, that's major, you know, it's like, that's really loose sort of thing.
Yeah.
So it's good that way, yeah. I'm not complaining when I say these things. I'm sort of saying, yeah, I can see it. It's just, I guess sometimes I get a little bit impatient trying to advance it along, but that's actually me, like a ball of a game.
Paul, let me tell you a secret. That's like, I think it's a prerequisite to get knee pain.
Yeah.
Is to be impatient. Like, I was so ridiculously impatient before. I mean, I still am. I still am. But it's like a requirement to be some degree of impatience, because we blow past, like, we have all these blind spots that the knee's been hurting for weeks and months and years, and we ignore it, and it's like, because we're impatient, we got to get things done, and then all of a sudden the knee's finally screaming so loud that it's like, I can't ignore it anymore. And that's where we got to backtrack a little bit, and we really got to settle into a solid foundation of developing the skill to get your knees out of pain. And when you do that, when you have that skill, then I don't care how much you surf, how much you bike. Like, it doesn't matter to me. The exercise, you can push and push and push on the other side of it, as long as I know that you could get yourself out of pain, and you know your recovery time after you pushed your knees. Yeah. Cool. I got a question for you, and I want to. I'm asking your permission, actually. I recorded this call, and what ends up happening is, if I tell someone I'm recording it, then it's like, and the responses are kind of canned, and I wanted it to be genuine. So if you're not comfortable at all, I may take a quote or two and ask you if it's okay, but if it's okay with you, I'd love to use it in, like, sharing with other people, because the space that you're in, that it's like the impatient, the wanting to exercise and enjoy your life, is what so many people are running into, and they're just like stuck with that. And I just want to get the message out to more people how they could be helped. Okay, great. What?
I said you're helping me, so I don't mind helping you back.
Thank you. Did you have any other questions? Anything else?
Pretty good, yeah.
Okay. Yeah, why don't you spend a good portion of the time this week doing more pain pattern interrupts? Do the same routine of what we've been doing, but give yourself a little bit more recovery time. Just give it a chance to rest a little bit more, and then let's see where we are next time we talk. Okay?
Okay, thanks, Bill.
Awesome, Paul. Thank you so much. Okay, bye-bye.